Introduction. Again, my name is Leslie Lim. I am the Director of Admissions here at Ketchum University. I have been with the program since inception, so I've been here for about 11 years. And I also have our admissions counselor, Gloria Lopez, who will be talking a little bit more about the admissions process. So we're very excited to talk a little bit about our program and what we have to offer, and just also share about more with the PA profession if you're not familiar. So I'm not sure. Are you able to see this screen, Gloria? All right. Can everybody see the screen or?
Yes.
Yes, we're good.
Okay. Gloria, I think this needs to be in full screen, I think.
It's still loading on my end. I apologize. It's a little slow
Okay.
for presenters.
But no worries. So we're going to talk a little bit about just the PA profession. I'll give an overview on that, and then I will also will cover a little bit more about the program, also the admissions requirements, and then we'll answer any questions. We'll leave later at the very end for questions and answers. So what is the PA? So you may be familiar with the term physician associate. We just changed our name recently, but PAs are licensed medical providers. They practice medicine in the healthcare teams with physicians and other providers. They are licensed to work in all 50 states, in other countries outside the United States as well. PAs are licensed clinicians who practice medicine in every specialty and setting. So you can find PA in almost in any medical specialty and setting as well. And so what can PAs do? PA-specific duties, again, depend on the setting in which they work, their level of experience, their specialty, and state laws. But PAs can conduct physical exam, diagnose and treat illnesses, write prescriptions, perform procedures, assist surgery as well. PAs can also educate patients on their families, counsel on preventive health care, and also make rounds in hospitals. So PAs have a lot of autonomy, so they can do many things in the healthcare field. PAs practice in every medical setting and also in every work setting. The top primary practice specialties that a lot of PAs go into is family medicine, orthopedic surgery, emergency medicine, urgent care, dermatology. So you can find PAs, again, in different specialties as well as in hospitals, medical offices, community health centers, nursing homes, retail clinics, and workplace clinics as well. Oh, is it frozen in my end?
Yeah, I'm sorry. It's frozen. It's not letting me switch slides.
Okay, there we go. So PAs in today's economy, it's a competitive salary. PA median salary is about 115,000. But it really again's on your specialty and where you choose to live in the practice that you choose. So that is just the average of the annual of PA salary. It may be quite different from graduating recent graduates as well, but as you can see, a lot of the salaries really depends on which PAs tends to practice in. It is rated as one of the best, ranked at #2 as one of the best healthcare jobs and #3 in 100 best jobs rankings. So how are PAs different from nurse practitioners? PAs and NPs do have similar responsibilities and what they can do, but they are different in the sense that PAs are educated more in general medicine, and then nurse practitioners, they need to hold a bachelor's degree and then pursue a graduate nursing program. PAs are trained to practice medicine using a curriculum that is modeled on a medical school education, whereas you are trained for nurse practitioner, you are trained in advanced practice of nursing. PAs, you have to attend a master's program based on medical education. And then for NPs, you have to graduate from a nursing program. And also the neat thing about PAs is that you can change medical specialties during your career, whereas nurse practitioners, you must choose a population that you would like to focus on. You can learn more about the profession. American Academy of Physician Associates is one of our associations. You can definitely get some more information about PAs and what's going on in the PA world. And then PAEA has great resources as well if you're looking to learn more about the profession. Okay, so just a little bit about our PA program. We are located in Fullerton, California. If you're not familiar with the area, we are about maybe 10 minutes away from Disneyland. But we also have two other graduate programs here as well. We have an optometry and a pharmacy program. The program here at Ketchum, it is a postgraduate level program. So you are educated on the master's degree level. Our program is 27 months. So the first phase, you'll be in didactic, and then the second phase, you'll be in clinical. So the first year, you'll be in the classroom, and then in the second year, you'll be out in clinical rotations. Our cohort size is 40, so it's a very small class size. And I really like it a lot just because it really gives that family feel and an opportunity for us to get to know our students. We have a low student to faculty ratio of 8:1. And what's really unique about our program is also our system-based module curriculum, which I'll go a little bit more into details about it later on in the presentation. Program submissions. Oftentimes applicants always ask, well, what are you looking for in an applicant? And I always revert them back to our program submissions because it really highlights the qualities and characteristics that we're looking for in an applicant. So our mission here at Ketchum is to educate individuals to become competent and compassionate PAs who can provide the highest quality healthcare in a collaborative environment, are dedicated to their communities and also advancing the PA profession. So when you are looking and researching for programs, you want to ask yourself, does the program's missions aligns with the values and goals and what you're looking for in a program? I mean, it's really just as important as well that you're looking for a program that it's a right fit for you. And here at Ketchum, we also have a strong emphasis on serving the underserved through our community outreach events, and then a lot of our rotations is also in underserved communities. So your first year in PA school will be in the classroom. So students will take courses majority based in medical sciences, behavioral sciences, and behavioral ethics. And I think, Gloria, I think you have to like press the tab. I think it's like a little bullet point. There we go. So our system-based module curriculum, what that means is that our curriculum is organized into system-based modules, which means that each body system, the student will be able to learn about the anatomy, physiology, pharmacology that pertains to that system. So for example, it's very different from your traditional learning format. In the system-based curriculum, let's say for instance, you're in the cardiology module, you will learn about the anatomy, the physiology, different diseases, and medication that pertains to the heart. So that module could last you about maybe 3 to 4 weeks, right? So you learn everything about the heart. You have one exam that covers at the end of the module on a Friday that covers just cardiology. You take your exam, and then if you pass your exam, you have the weekends off, and then you start a brand new module on Monday, and that could be nephrology. So it's really neat because it allows our students to be able to view the patient as a whole from top to bottom. And each of the modules, it builds on each other, and it's organized in a way where it assists learning. And the really neat thing about it is that you don't have to study for one big exam while attending different classes in different subjects. So our students really like it a lot because it's breaking down into different body systems, and then they'd be able to comprehend and apply what they learn and have one exam that covers it before moving on to the next module system, the next module. We utilize a competency-based system, and what that means is that your exam will be a pass or no pass. In order to pass, you need to score a minimum of 80% for your exams. And what we do like about our competency-based system is that it eliminates competition in the classroom, where it allows you to work with each other collaboratively and be able to share notes and help each other. So it's very common for us to see our students forming groups and study groups and skills to practice sessions together. You will also have, individual and group assessments and clinical skills as well as part of the type of exams during your first year. And also IPE through simulation and standardized patients. So once you complete your first year, I always joke that your second year PA school is the fun year because you get to apply what you learned from your first year into your second year. So traditionally, our students, once they complete the first year in their classroom, they will move into clinical year, which is typically start in November, and it runs right through to the following November. But you'll have the opportunity to work with physicians and certified PAs whose collaborating physician are licensed and board certified in their setting. So this is an opportunity for you to be able to learn and ask questions. You will be required to complete 7 rotations in the required clinical settings. So family medicine, internal medicine, emergency medicine are just a few. And also you will need to complete 1 rotation in an elective setting. So if you want to specialize in ortho, cardiology, dermatology, you can select one of the setting as one of your clinical elective. And our students are also required to complete at least 1 rotation in an underserved site as well. Since Ketchum is a California-based school, majority of our rotations will be in Southern California. These are just a few of our affiliations of the hospitals and clinics that we are affiliated with. As you can see, majority of our sites will be in Southern California, and we do have a few in the Central Valley and then as far south in Raleigh. Each student can expect to have 2 away rotation, less than 45 miles. We don't typically send students out of state unless they make that request to have their rotation out of state. But also keep in mind that sometimes a state or a site will deny a request. But you can definitely work with our clinical team if you have any clinical sites or that you would like for us to be affiliated with. We can go ahead and work on getting an agreement there. But usually majority of our rotations, again, we will typically will be in Southern California. Some of the technology here at Ketchum, we have an anatomosh table, which is a 3D anatomy cadaver lab. It definitely allows for our virtual dissection of organs and tissues from different angles. So it's pretty much like a giant tablet. And it's really neat because students can view and dissect organs, again, from different angles and be able to restore the scans to the original state and be able to try again, which was really neat because, when you're in PA school, you just don't have that much time to be sitting down with a real life cadaver. So this is really neat because our students really use this during their anatomy and physiology modules where they are studying and being able to work with it hands-on. We also have our simulation lab. So we have our SimMan 3G, which is a highly advanced mannequin, which is capable of producing many body and health conditions. So our sim man can blink, it can talk, it can breathe, it can cry. And our faculty can also manipulate the blood pressures and vital signs. Let's say, for instance, a student does not give the sim man the proper treatment, that sim man can. So it really offers our students a way to practice giving care, and also an opportunity for students to work and learn together. We also have Ketchum Health, which is about 7 miles from our main campus, but it houses our eye care center, our family medicine medical clinic, and also our pharmacy research lab. It is a clinical teaching facility, so our students will be able to rotate through Ketchum Health Family Medicine Clinic as part of their rotation. All right, so applying to Ketchum. So the CASPA application cycle opens just, I think, on Wednesday, on April 24th. But our deadline to apply to our program is September 1st. It is a non-rolling admissions program. So there's no advantage if you submit your application early on in the application cycle or later on in application cycle, because we will review applications as soon as we receive it on September 1st. And we will start making interview offers and offering seats once we have concluded our interview process. So we will still have 40 seats available. Again, there's no advantage whether you submit it right away or wait till closer to the end of the cycle. But our process, you will be able to the first step is that you'll submit your application through CASPA. Again, it is a centralized application service for PA. So this is where you'll submit all of your documents, your transcripts through CASPA in order for have the program to review. It will then go through a review process, and then we will select the most competitive applicants for an interview, and then make our final decisions typically in November and December. All right, Gloria, I'll go ahead and hand this over to you in regards to the admissions requirements.
Okay, sounds good. So for the requirements in order to apply, you do need to have your bachelor's degree. We are also going to ask for 3 letters of recommendation, and we do strongly encourage you to have a letter from a physician. Usually people that you work alongside with are the best people that can write that letter of recommendation for you. We want to know how you interact with patients and how you work in a collaborative environment. We do have supplemental questions that are actually already embedded into the CASPA application. So as you fill out your CASPA application, you're going to go ahead and take care of those supplemental questions as well. Once you submit your application, you will receive a confirmation email from CASPA letting you know that we have received your application. And then you'll receive an email from MBKU to the Ketchum portal to go ahead and take care of your supplemental fee as well. Another thing that we require are 2,000 hours of direct hands-on patient care experience. And we can talk a little bit more as far as the types of experiences that we do take. We strongly encourage our applicants to have an overall GPA of 3.0 and an overall science of 3.0, and to have community service. Community service is something that MBK is very much passionate about, and we do try to sprinkle it throughout your time here with us as well. So we do like to see that aspect reflected in our incoming students. This is a list of our prerequisite courses. So you do need to have a letter grade of C or better in order for these courses to be accepted. And they do not have an expiration date. The only 2 courses that do have an expiration date are Human Anatomy with Lab and Human Physiology with Lab. If these courses are older than 7 years, you do need to go ahead and retake the courses in order to be eligible to apply. I know during COVID, a lot of schools were offering the pass and no pass as your grade, and we will go ahead and take pass and no pass for any courses that you have taken. When you are applying, you can have up to 2 of these prerequisites in progress. Usually fall semester is the last semester that you can enroll in these courses in order to meet the December 31st deadline of when we need to have updated transcripts for them as well. We are currently accepting online courses and online labs from accredited schools. If you do want to make sure that a school is accredited, you can always go on their website, and we also have a list on our portal that you can check the type of accreditation that is offered at that school. So clinical experience, this list is very short, but we have an extensive list of different experiences that we take. We are looking for these high-level responsibilities and training that you have within these roles, things like taking vitals, administering medication, administering shots, things like that. So these lists is some of the most popular ones that we do see. If you do have specific questions about maybe you're looking to get patient care and you want us to take a look at your responsibilities to ensure that it will count for those 2,000 hours, you can always email us, and me and Ms. Lynn would be happy to confirm if those hours are going to be accepted. As far as shadowing hours, we don't have a minimum requirement for that. We do encourage you to shadow in maybe a specialty that you're interested in to see what their day-to-day would be like, and if you can really visualize yourself there once you do become a PA. So interviews. Our interviews are usually done from October through December. As Ms. Lynn mentioned, we don't start to review any applications until after the September 1st deadline. We do offer in-person and virtual interviews. For virtual interviews, we do try to reserve those for people who are out of state or out of a certain mile radius from our campus. We do use our campus as our home base when we are making those invites to see if you would need a virtual interview. And a little bit about the interview, what your day would be like. It's usually about a half day that you'd be spending with us. You would have an individual interview with a faculty member or a community PA. There is a group interview as well, a writing assessment, but it's nothing major. We just need like a small writing sample from you. So that's the part that you really don't need to stress too much about. You will also get a chance to tour our campus. We'll show you around, and you'll have an opportunity to meet some of our current PA students. So they'll kind of be your guide for the day. You can ask them questions throughout the day, as well as they guide you through your interview. So this is our information. If you do have any questions, we do offer one-on-one virtual meetings with myself and Ms. Lim. If you are interested, and I'm happy to share this information to be passed out as well after today. And we're happy to answer any questions if you guys have any.